Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay. And 5, 4, 3, 2, 1. Welcome back, everyone. You're listening to Policy and Rights here on Depictions Media Radio. I am Michael, your host, and we had an election here in Canada, and the results of the election turned out to be much of what we had before the election. I'm sure that Justin Trudeau and Aaron O'Toole were hoping for something very different. I think both of them were looking to form a majority government, in which case they'd have absolute run of what the policies would be overall. But instead, we wound up with a liberal minority government. And that means that how things will be decided also depend on the NDP with Jagmeet Singh and also the Quebec Bloc Party. They will have a significant say and a significant vote in how things happen, which is probably really a good thing, because we're still in a pandemic. We're still in what would seem to be an economic downturn. Whether it is because of the pandemic or not, that isn't absolutely been proven. We still have the problem of vaccine mandates. We still have the problem in front of us that is the vaccine ID cards and vaccine passports. It is, of course, my opinion that whether we've been vaccinated or not is a private matter and shouldn't necessarily be left up to the government. And for all of you who feel this way, I warmly invite you to go talk to government officials, especially elected officials, your MP, your MLAs, and talk to them. Tell them how you feel, because that's where it's going to change the mandate. Don't go to the local business or whatever the chain restaurant is and tell them that you disagree with their policy, because they didn't form the policy. They have to obey it in order to stay in business. We need to go back to the government and tell them that this mandate of vaccination is actually splitting our society, and we need to go back. All of the party leaders go back and come together with something that will unite Canada so that we're all on the same page, so that we all feel comfortable with being in society. Ostracizing a group and protesting businesses and disrupting hospital functions isn't going to do anything other than hurt ourselves. Going to the government and telling them we want something that is going to be united, that we all feel good about what is going on, that we all feel like we're part of the conversation, is the true answer. And that is why we call ourselves a democratic society. Okay, so moving on. One of the really big issues globally is the fact that while Canada itself is nearly over 80% vaccinated. That there's other parts in the world that haven't even hit 1% of vaccinations. Most of the world is probably less than 20% vaccinated. In that, as we open up to other countries and we open up ourselves to the world, is what the really bigger problem with the variants is going to be. The variants are the virus's way of finding resistance. So, what we need to see happen, and this is what the plight of the WHO and the Pan American Health Organization is saying, that we need to find ways to get vaccines and doses into those countries such as Haiti, which is less than 1% of the population has been vaccinated. Granted, they have been hit with several disasters, which means that their government is in peril with being able to even purchase vaccines, not alone how do they distribute them. They need help. And this is what our country, with being 80% vaccinated, can do to help lower the rate of variant changes and help prevent the virus from coming back to our country in different forms, is to actually donate to those countries, help them develop the ability to build the vaccine technology in their countries or near their countries, because the countries are just too small to have a mass factory. But if a bunch of smaller countries can come together and help build the vaccines, and this is what one of the plight of the Pan American Health Organization, which we're going to hear from Dr. Carissa Etienne in just a bit. The Pan American Health Organization, at the helm of Dr. Carissa Etienne, announced that the organization has entered an agreement with Sinovac, which in advanced discussions with other manufacturers to purchase additional COVID-19 vaccines on behalf of countries to complement bilateral deals and donations of doses to be received on an international mechanism with COVAX. She said that, quote, "We have reached an agreement with Sinovac and have begun accepting orders that will be ready for delivery this year. And we are expecting to sign a new deal in the upcoming days to buy vaccines that have emergency use listings, approvals, and other suppliers for 2021 and 2022. So, and this came from the latest press briefing, which we're going to play for you right now. Thank you for listening to Depictions Media Radio.
Ecuador and Peru. Vaccines, as you know, have the power to save lives and to change the course of the pandemic. So today, I want to offer an update on immunization efforts in the Americas. More than 1 billion COVID-19 vaccine doses have been administered in our region, and 35% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19. But importantly, coverage is not uniform. While Canada, Chile, Uruguay, and Puerto Rico have fully vaccinated over 70% of their populations, 10 countries and territories in our region have yet to reach 20% of their populations. And in Haiti, fewer than 1% of people have been protected thus far. Most countries continue to have limited access to vaccines, so we are encouraged by the announcements made at last week's Global COVID-19 Summit, where world leaders pledged an additional 850 million COVID vaccine doses, and where President Biden announced that the United States itself will donate an additional 500 million vaccines to low and lower middle income countries, bringing the total US donations to over 1.1 billion doses. At that summit, I told participants that overcoming this pandemic rests on having the tools to prevent, detect, and treat COVID-19, and that we must expand global vaccine production by leveraging the expertise and capacity of regions like our own. Meanwhile, vaccine donations remain the fastest way to support countries in our region. PAHO has helped COVAX deliver 50 million doses to our region, including nearly 14 million donated doses. And we have the capacity to quickly scale this support. So we urge countries not to delay their donations as lives hang in the balance today. Indeed, PAHO is doing everything that it can to accelerate vaccinations in our region. Over the next few months, PAHO will work closely with COVAX to deliver tens of millions of doses to our region, many of which are allocated for countries with low vaccine coverage, like Jamaica, Guatemala, and Nicaragua. Our technical and procurement teams have been working closely with these countries to help them prepare health workers and health systems so they can absorb and administer these vaccines quickly. For example, we are on the ground in Haiti, helping the country make the most of the vaccines that it has on hand, and working with the Haitian governments and international partner NGOs to plan for additional allocations of vaccine supply in the coming months. Special attention is also focused on uptake of vaccines in the areas affected by the earthquake. Looking ahead, we must use all possible strategies to access more doses. Our revolving fund is in advanced discussions with vaccine manufacturers to purchase additional COVID vaccines on behalf of our member states to complement bilateral deals, donations, and doses that they are receiving via the COVAX mechanism. We are really happy to share that we have reached an agreement with Sinovac and have begun accepting orders that will be ready for delivery this year. And we are expected to sign new agreements in the coming days to buy vaccines that have the emergency use listing approval from other suppliers for 2021 and 2022. But administering vaccines requires more than just doses. Today, we need more syringes as vaccination campaigns ramp up. PAHO has already secured over 150 million syringes for our member states, and the revolving fund is working to finalize shipments for the rest of 2021 and to consolidate country demand requirements for syringes and safety boxes for 2022. As we address these immediate gaps, PAHO is also working to expand our region's manufacturing capacity to build a more sustainable and dependable supply of vaccines and medical technologies. Latin America and the Caribbean have imported nearly all the medical products that they've used in the COVID response. And today, we're paying the price as we continue to face delays in production. But our region has the capacity and expertise to lessen our dependence on global suppliers. After reviewing more than 30 proposals, an external and independent committee of experts selected 2 projects: the public producer Biomanguinhos Institute of Technology on Immunobiologicals at the Oswaldo Cruz Foundation in Brazil, and the private company Synergium Biotech in Argentina, to receive technical support from PAHO and WHO to accelerate the development and production of mRNA vaccines. That is the same technological platform that is used by Pfizer and Moderna to do that in Latin America and the Caribbean. This is a strategic initiative because mRNA technology can also be used to develop other virus vaccines for relevant public health problems in our region, such as Zika, dengue fever, and others. Both of those institutions that were chosen have a long track record of vaccine manufacturing and will build on this legacy to protect people across the region from the threat of COVID and from future health risks. All vaccines that will be produced under this initiative will be available to all countries in Latin America and the Caribbean through PAHO's revolving fund, benefiting the entire region. Of course, there are many steps to making vaccines. So we are also inviting public and private pharmaceutical manufacturers that can develop and produce essential components for the mRNA vaccines to become a part of this regional platform. Applications are open until October 15th, and we encourage suppliers across our region to apply. And finally, we are counting on the support of member states, financing institutions, and others to prioritize investments in our regional supply chains. Because while expanding regional pharmaceutical manufacturing will require significant investment, the cost of inaction is simply too high, and we cannot go it alone. So once again, I urge countries, institutions, and partners across our region to work together so we can overcome this pandemic faster and be stronger and more resilient when the next crisis strikes. Thank you.
And prepare, Dr. Etienne.
Thank you for this question. As we have said before, the COVID-19 pandemic cast a spotlight on how health, the economy, and social development are intertwined. For health security and development, we need to ensure universal access to health. And COVID-19 has also shown that we need emergency preparedness, a greater capacity to detect and respond rapidly to any risk. And we need to be able to deliver emergency health services at a moment's notice. This, of course, will require the strengthening of essential public health, including surveillance and digitized information systems. The path to recovery from this pandemic, to control sustained transmission, to help people work and live again with mental health and well-being, is through concerted actions, and let me highlight 3 key areas. First, controlling the spread of COVID-19, including its variants, vaccination at high coverage levels, and adherence to public health measures are extremely important. Secondly, maintaining surge capacity in health systems and services to tackle COVID-19 while addressing other priority health needs. And finally, and very importantly, ensuring equitable access to safe and effective vaccines that are delivered to all. Today, we have healthcare delivery networks that are mainly hospital-centric instead of being people and community-centered. They are focused on resource generation, instead of health outcomes, on illness and disease instead of the holistic health and well-being of the individuals. This obviously has to change. To prepare for the next crisis, we need to focus instead on the first level of care, or what we call primary care. And we believe that 70% of health needs of the population can be successfully addressed at that level. And yet, financial investments at that first level of care remains minimal. Certainly, I am convinced that we need increased levels of health financing. We need improved utilization of resources to address inequities, the elimination of out-of-pocket expenditure, and increasing efficiency within our systems. In the same token, we need more investments in health research and to be able to apply scientific evidence in public policy making so that we make decisions that are based on the most current scientific knowledge. Most importantly, we need to build self-sufficiency so we can respond better to future health emergency needs when they occur. Investments in science, technology, and the industrial base in developing countries are essential for the future. And PAHO is working with member states on all of the above, ensuring that we can successfully confront this pandemic and bring it to an end, but at the same time, begin preparation for the future. Not only recovery from COVID-19, but also building stronger health systems, building capacities to address the emergency, so that we are better prepared to deliver quality care and to ramp up for emergencies. Let me thank you all again and for being with us. And let me remind everyone, please keep safe. Get vaccinated immediately as it is offered to you. And please observe the public health measures.
Okay, so hospitals are being overrun, or at least they're being reported to be overrun in areas across Canada, and a lot of it is due to the variants. The mass media, of course, is reporting that because the government is saying that it is due to unvaccinated people, that you have to decide for yourself. It is not for the government to decide. It is not for anyone other than for yourself to decide that. But I will say this much, that the government should be willing to allow public health officials and public health agencies such as the CDC to report raw data and processed data to media sources so that we can report those numbers to you so that you can actually make an informed decision. Again, do not go rushing off to the public health officials or the CDC to demand this information from them. That's not exactly going to do anything other than disrupt the system that is actually there to help people. What we need to do is, again, write to your MLA, write to your MPs, write to elected officials, and get the mandates changed so that they can officially share that data with the public. Again, Dr. Etienne says to obey the public health orders, and we should be obeying those public health orders. We should be doing the things like washing our hands, and we should be doing the things with social distancing. One of the researches that has come out that whether you're vaccinated or unvaccinated, you're just as likely to carry the virus and be non-symptomatic and spread it to others just the same. Some other research that it is entirely possible that this is a airborne virus, in which case the spread of it is very easy to do. It's not a contact surface sort of a virus. So we do need one. If you like, ask the public officials for more information, raw information, not processed information. So moving forward, climate change. Climate change is always a hot button thing, especially around here. And it would seem that the British Columbia Site C Dam has resurfaced again, and the British Columbia Premier John Horgan was speaking about it. When he ran for office the very first time, he said that he was going to shut Site C down because it was an immense disruption to the environment and an immense money sink. Well, by the time he got to office, he claims that he is now running with it because he couldn't stop it. It was too far along, and too much had been done in order to just simply switch it off. So the project has moved forward under his watch and his provisions, and he made some announcements about the dam and about electrifying our society, that it is going to become more electrified. There's more push towards electric cars. There's more push towards us using more and more electric power, which does actually pose a need for the Site C Dam in British Columbia, and how it can help electrify not only British Columbia but its neighbors, such as Washington, D.C., Oregon on the U.S. side, and the Northern Territories above British Columbia, as well as possibly even Alaska. So, as it turns out, the site is going to become important. But here's the thing: the price tag. And John Horgan admits that the price tag is high, and he is trying to do things through the public utility commissions to actually keep that price tag to the public as low as possible. So, the big thing is, though, our dams, as clean energy as we can actually provide. There are other ways of providing pollution-free energy without using fossil fuels. We all know that fossil fuels releases carbon into the atmosphere, which those carbonized gases are greenhouse gases, and they help push along the rising temperature of the planet, especially at the poles where our major ice caps and controls of our weather system actually start to happen. There are projects in Europe also that are involving coal fusion, but they're extremely expensive again. So we need these public utility commissions to be open to the public, so that when we get the electric bill in the mail, that it doesn't eat up our food. Meaning that while we're paying the price for electricity in our homes to help our homes function, that we don't have to give up going to the grocery store, give up our medications, things like that. There are big issues with having to pay a higher premium for electricity in our homes and to run our society. And we need our elected officials and public utility commissions to help curb that. So let's listen to what John Horgan actually has to say about the Site C Dam and about this electrifying project. Thank you for listening to Depictions Media Radio.
Good morning, everybody, and welcome. I'm Kelly Greene, MLA for Richmond-Steveston and Parliamentary Secretary for Environment. It's my pleasure to join you today at our Vancouver Cabinet offices on the territory of the Musqueam, Squamish, and Tsleil-Waututh Nations. I'm here with Premier John Horgan, Minister of Mines and Low Carbon Innovation, and Chris O'Reilly, President and CEO of BC Hydro. Walking in this morning to our offices here at Canada Place, I savored the sights and sounds that were all around me. The high-rises, the busy road, the waterfront, and people everywhere at work and play, businesses and factories and green spaces, and the turning leaves, misty mountains, and ocean under the autumn sky. It's a panorama of life, land, and sea that defines this place we call home on the west coast of British Columbia. It's a view that not only showcases the beauty, diversity, and interconnectedness of our urban, ocean, and national environments, but captures the sweep and scale, the challenge, and the opportunity for climate action. It reminds us why it's so important, and it's why we're here today. And with that, I'd like to introduce Premier John Horgan.
Thank you, Kelly. And I too want to acknowledge the traditional territory of the Squamish, Musqueam, and Tsleil-Waututh First Peoples. And also my colleague and friend, Minister of Energy, Mines, and Low Carbon Economy, Low Carbon Innovation, Bruce Ralston, as well as the CEO of BC Hydro, Chris O'Reilly. From heat waves to wildfires, the devastating effects of climate change are all around us. Although we have multiple crises right now, whether it be the opioid crisis of some 6 years now, the COVID-19 crisis, we also have the extraordinary challenges of trying to deal with a global phenomenon, and that is the warming of the earth and the consequences on human activity. Here in British Columbia, our Clean BC plan is making real progress. We have North America's most progressive plan, and we're regulating emissions of big polluters. We're taking action on targets with accountability, as well as, of course, assisting people in shifting their activities to reduce their carbon footprint and have a cleaner, better life for all of us. But the scale of the climate crisis is enormous, and that requires more activity by government. We need to make sure we are less reliant on fossil fuels. We need to make sure that we can shift away from a fossil fuel economy to a cleaner, greener economy, powered by the water, powered by BC Hydro's clean electricity. We are a powerhouse when it comes to clean electricity. 98% of our electricity is generated through clean, renewable resources. And while we are North America's most aggressive clean power producer, 3/4 of the energy used in British Columbia still depends on fossil fuels, whether it's our cars, whether it's heating and cooking with natural gas, whether it's amounts of fossil fuels. And that needs to change. And that's why we're here today to announce BC Hydro's electrification plan going forward, a path to a cleaner, greener future, powered by BC Hydro's clean electricity. Now, this is an ambitious program that will see over the life of the program a reduction of 900,000 tons per year of greenhouse gas emissions. That will take about 200,000 cars off the road, and we can achieve these goals through practical solutions that Bruce will lay out for you in a minute. Those solutions will lead to what we call energy switching, moving away from fossil fuels and taking up more clean, green, electrified options, like offering homeowners rebates for heat pumps, already a program underway at the federal and provincial level. BC Hydro will now be supplementing those incentives so that we can accelerate the removal of natural gas and oil and other noxious emissions from our heating sources and change those over to clean energy. We'll see more fast charging stations for electric cars, already a hit here in British Columbia. We'll move from BC Hydro's current 98 fast start charging stations to 325 over the life of the program. And that will include also encouraging clean businesses to come to British Columbia, to take advantage of that opportunity to use low carbon energy to create more clean green activity, like hydrogen production or carbon capture technologies. All of these issues can be addressed by having a coordinated plan. And when I appointed Minister Ralston to the job of Energy Minister, I asked him to work with BC Hydro to bring together the Clean BC programs that were in his ministry and make sure that we were supplementing that activity, taking advantage of the competitive opportunity we have by having a well-run, clean energy production facility through BC Hydro's two-river policy and a whole host of other clean green generation options. It really does separate us from other jurisdictions in Canada and indeed Western North America. Now is the time for British Columbians to work together with BC Hydro to reduce our personal impact on climate change by switching fuels, by moving to a heat pump, by looking at getting that electric car, by doing what we can to encourage our industries to reduce their emissions by attracting new industries that are low emission producing. So with that, I'll pass the microphone back to Kelly Greene, and she'll move it on to talk more about the electrification plan that we have in store for British Columbians.
Thank you, Premier Horgan. And now I'd like to ask my colleague Bruce Ralston to tell us a bit more about the electrification plan. Bruce is BC's Minister of Energy, Mines and Low Carbon Innovation. Bruce.
Thanks very much, Parliamentary Secretary Greene. I'm pleased to join you, Premier Horgan, and BC Hydro's Chris O'Reilly on the territory of the Musqueam, Squamish and Tsleil-Waututh peoples. Our government and BC Hydro share common goals to shape a clean energy future, support existing clean energy innovation in British Columbia, and bring new clean energy to our province. As the Premier has outlined, BC Hydro's electrification plan sets out ambitious actions and investments that will help us achieve these important goals together with British Columbians. We plan to use BC's clean power advantage, the power of water, to transition away from using fossil fuels like gasoline, diesel, and natural gas to using clean electricity. Over the next 5 years, BC Hydro plans to spend more than $260 million to advance electrification here in British Columbia. This includes more than $190 million to promote fuel switching in homes, buildings, transportation, and industry. Homeowners can benefit from new top-up incentives that could save them an additional $3,000 over existing rebates on an electric heat pump if they're switching from natural gas. Our province leads the country with more than 60,000 light-duty electric vehicles on BC roads, and that number is growing fast. Therefore, we plan to more than triple the number of public fast charging stations by 2025. So EV drivers will have more places to get a quick charge as they travel around the province. We're also providing more than $5 million in incentives and other supports to help businesses move forward with commercial building retrofits and the electrification of new buildings. There's more than $60 million in incentives for industrial fuel switching to encourage our most energy-intensive industries like mining, forest products, and pulp and paper to use less gas and diesel and more electricity to run their operations. As companies around the world look for ways to reduce emissions and improve their environmental profile, BC's clean electricity and strong climate policies look more and more attractive. The plan seizes on that opportunity with more than $50 million to attract new clean industry and investment here to British Columbia. These are just a few of the many programs and incentives included in BC Hydro's new electrification plan. And as the Premier noted, by increasing demand and selling more electricity, BC Hydro rates will be lower than they would have been otherwise. This plan is a win for all British Columbians. BC Hydro is the cornerstone of our clean energy future. This electrification plan builds on the enormous contributions BC Hydro has already made as we work together to reduce emissions and achieve our Clean BC targets. The plan will help people and business take action to lower their environmental footprint and contribute to the fight against climate change. It will attract new investment and innovation to British Columbia, generating economic development and creating good, sustainable jobs. Our government looks forward to working with BC Hydro, Indigenous peoples, stakeholders, and communities around the province to implement the plan and power more and more of our lives with water. Thank you very much.
Thank you, Minister Ralston. Chris O'Reilly is the President and CEO of BC Hydro, and I'd invite Chris to the podium to say a few words.
Thank you, Parliamentary Secretary Greene. So I also want to acknowledge that we're here today on the traditional territory of the Musqueam, Squamish, and Tsleil-Waututh. We're very privileged to be in a relationship with all three peoples. We're very proud of the work we've done on reconciliation with them, and it gives us hope for the future in this week that we mark the first day marking the Truth and Reconciliation Commission work. This is an exciting day for BC Hydro and for all of BC. I want to thank Premier Horgan and Minister Ralston for their support for the electrification plan. For decades, BC's dams and generating stations have been providing clean electricity for homes, for businesses, and for industries. The impacts of climate change, though, continue to confront us. One of the most visible and tragic impacts has been the effect of extreme weather here in BC, the drought conditions and heat wave and fires that caused so much devastation this past summer. British Columbians are looking for ways to make change. Thanks to the clean power advantage we have here in BC, we are well positioned to act on climate change and to reduce greenhouse gas emissions by reducing our reliance on fossil fuels. BC Hydro has been supporting electrification initiatives for a number of years, but our electrification plans aims to increase awareness of existing programs and develop new programs to address the barriers to electrification that exist. Through financial incentives, programs, and studies, BC Hydro is offering practical ways for businesses, residents, and industry to make a difference. We have a strong history of delivering on plans to help our customers make good decisions around energy and shaping the province's energy future. The Power Smart program that was created in 1989 helps our customers manage their demand for electricity. And the program encourages energy conservation and energy efficiency and has yielded great results for our province for many years. It gives BC Hydro customers the tools and the information they need to make a difference. The electrification plan marks the biggest evolution and milestone in Power Smart in more than 30 years. And we're building on that experience and the success of our conservation programs to again encourage people to use the resources wisely to have the biggest impact. But today, WISE also means using clean electricity to reduce our carbon emissions. In addition to helping existing customers switch, we're also rising to the challenge to bring in new customers to power their businesses with clean electricity from BC Hydro. Globally, companies are seeking to improve their environmental and social and governance profile, and because of our clean power, BC is well positioned to attract new energy-intensive companies. As part of the electrification plan, we will work to ensure it's easier for new customers to connect to our grid. And this move to power our existing economy with clean electricity and attract new customers will help British Columbians by keeping rates affordable. The programs are designed to complement and build upon existing actions and initiatives funded by government and by BC Hydro that are focused on reducing carbon emissions and help support the environmental and economic objectives in the province's Clean BC Climate Action Plan. Thank you very much.
Thank you, Chris, for all that you and everyone at BC Hydro does for your commitment to a cleaner, brighter, and more sustainable future powered by water. As Parliamentary Secretary for Environment, I am so thankful to have BC Hydro as a working partner for our government to use BC's clean electricity to reduce emissions and stimulate the low-carbon economy and create jobs. You are playing a vital role in Clean BC, and this electrification plan is an important piece as we develop our roadmap to 2030, our detailed plan to meet Clean BC's emissions and clean economy targets. This is the only planet we have. Climate change is real, and it is upon us. Now is the time to seize the opportunity to reduce emissions and grow our low-carbon economy. Thank you all for coming, and I'm going to turn it over now to our moderator for any questions from reporters. Thank you.
Okay, so we have listened to what BC Hydro has for us, and clean electricity. At least it's carbon-free electricity, and that is always a really good start towards what it is that we need as a society, and what we need to move forward towards climate change. We need to actually not look for net zero solutions. We need to look for zero carbon gas emissions, or as close to it as possible. The focus of net, meaning that we've done something here that's really not so great for our society, to what we've done really positive to offset each other. We need to look for us just to start coming up with solutions that will lower our carbon gas emissions. Just lower them, not look for the let's subtract from here in order to add here or any of that sort of thing. We also need to look for these solutions to come rather they have a profit or not. We need to stop looking for solutions that are able to make people money, but instead just look for solutions. The money factor may be holding us back from finding those things that really could affect our environment and climate change and helping us to live better. So, you've heard me say earlier in the show that we need to impress upon our government to share the actual data, the raw data, and the unprocessed data. I've said this several different ways so that those listening understand what we're talking about, that we get the reports straight from the hospitals, who is being treated for COVID-19 and its effects, and who hasn't been. How overrun are the hospitals? In which hospitals are being overrun, in which neighborhoods, and which patients have been transferred from one hospital after being admitted to one hospital to another hospital that has a greater capacity. We need to actually see what is actually going on, and right now those numbers are not being provided to us. And matter of fact, there have been a couple of mass media reports that said that Minister Dix and Premier John Horgan have offered to, and so that they don't scare the public, have cut their numbers in half. There's been other reports that have quoted that the hospitals are reporting inflated numbers, that some of the numbers that they have been asked to report on COVID-19 have been inflated. Well, as the public, what is it that we are so expected to believe? There's only one thing that we can actually say, is that we are not being shown the actual numbers that we are being shown dressed up data. And as private citizens, we may not want to put up with such things, and we just need to be told. We are an intelligent society, and as an intelligent society, being told the truth so that we all can decide at the public table what needs to be done and what needs to happen in order for all of us to thrive is what is actually important. So the next thing is actually a COVID-19 update from British Columbia, of course, with Adrian Dix and Dr. Bonnie Henry. And they actually start talking about new ways of reporting the numbers. But again, it is going to be numbers after it has been processed and not the raw data. So again, don't go to the hospitals and ask for them to do these sort of things. Do not go to the public health office, and do not go to the CDC looking for this. We need to, again, address our elected officials. That's why we put them in office, in order to get what our society actually needs. So let's listen to what Dr. Bonnie Henry and Adrian Dix actually have to say about the reporting and what is going on in British Columbia with COVID-19. Before we get to that piece, though, I do actually want to address this, because I'm not going to actually be able to put the audio works on from these reports onto this particular show. In the Atlantic Canada, that PEI is looking to go into lockdown status again, meaning that they will be screening those who are allowed to travel in and out of Prince Edward Island. They are using a vaccine passport system to assist with that. And that there are Edmonton hospitals that are reportedly being overrun with COVID-19, and some of those reports are saying that, hey, the pandemic, even from the ICUs where people are being treated, are saying that the pandemic is not real. Now, granted, if people are saying that the pandemic isn't real, of course they're not vaccinated. This does not mean that all of the influx of people being treated for COVID-19 in such hospitals that are being overrun in Alberta are unvaccinated. There are vaccinated people also being treated for it also. So just because you have the vaccine doesn't mean that you won't be hospitalized if you get COVID-19. It just means that you've been vaccinated. So let's move forward with Adrian Dix and Dr. Bonnie Henry and what is actually happening in British Columbia. Okay, so we have listened to what BC Hydro has for us, and clean electricity. At least it's carbon-free electricity, and that is always a really good start towards what it is that we need as a society, and what we need to move forward towards climate change. We need to actually not look for net zero solutions, we need to look for zero carbon gas emissions, or as close to it as possible. The focus of net, meaning that we've done something here that's really not so great for our society, to what we've done really positive to offset each other. We need to look for us just to start coming up with solutions that will lower our carbon gas emissions. Just lower them, not look for let's subtract from here in order to add here or any of that sort of thing. We also need to look for these solutions to come, rather they have a profit or not. We need to stop looking for solutions that are able to make people money, but instead just look for solutions. The money factor may be holding us back from finding those things that really could affect our environment and climate change and helping us to live better. So, you've heard me say earlier in this show that we need to impress upon our government to share the actual data, the raw data, and the unprocessed data. I've said it several different ways so that those listening understand what we're talking about, that we get the reports straight from the hospitals, who is being treated for COVID-19 and its effects, and who hasn't been. How overrun are the hospitals? In which hospitals are being overrun, in which neighborhoods, and which patients have been transferred from one hospital after being admitted to one hospital to another hospital that has a greater capacity. We need to actually see what is actually going on, and right now those numbers are not being provided to us. And matter of fact, there have been a couple of mass media reports that said that Minister Dix and Premier John Horgan have offered to, and so that they don't scare the public, have cut their numbers in half. There's been other reports that have quoted that the hospitals are reporting inflated numbers, that some of the numbers that they have been asked to report on COVID-19 have been inflated. Well, as the public, what is it that we are so expected to believe? There's only one thing that we can actually say, is that we are not being shown the actual numbers, that we are being shown dressed up data. And as private citizens, we may not want to put up with such things, and we just need to be told. We are an intelligent society, and as an intelligent society, being told the truth so that we all can decide at the public table what needs to be done and what needs to happen in order for all of us to thrive, is what is actually important. So the next thing is actually a COVID-19 update from British Columbia, of course, with Adrian Dix and Dr. Bonnie Henry, and they actually start talking about new ways of reporting the numbers, but again, it is going to be numbers after it has been processed and not the raw data. So again, Don't go to the hospitals and ask for them to do these sort of things. Do not go to the public health office, and do not go to the CDC looking for this. We need to, again, address our elected officials. That's why we put them in office, in order to get what our society actually needs. So let's listen to what Dr. Bonnie Henry and Adrian Dix actually have to say about the reporting and what is going on in British Columbia with COVID-19. Before we get to that piece, though, I do actually want to address this, because I'm not going to actually be able to put the audio works on from these reports onto this particular show. In the Atlantic Canada, that PEI is looking to go into lockdown status again, meaning that they will be screening those who are allowed to travel in and out of Prince Edward Island. They are using a vaccine passport system to assist with that. And that in their Edmonton hospitals that are reportedly being overrun with COVID-19, and some of those reports are saying that, hey, the pandemic, even from the ICUs where people are being treated, are saying that the pandemic is not real. Now, granted, if people are saying that the pandemic isn't real, of course they're not vaccinated. This does not mean that all of the influx of people being treated for COVID-19 in such hospitals that are being overrun in Alberta are unvaccinated. There are vaccinated people also being treated for it also. So just because you have the vaccine doesn't mean that you won't be hospitalized if you get COVID-19. It just means that you've been vaccinated. So let's move forward with Adrian Dix and Dr. Bonnie Henry, and what is actually happening in British Columbia. Thank you for listening today. I implore you to go out and do your own research on the topics at hand, and take your own action into figuring out what is best for your homes, and your life. So, again, you've been listening to Policy and Rights here on Depictions Media Radio. I am Michael Clogs, and I have been your host. Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help. How we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. please contact us at depictions.media for more information.